So, Zach, I know it's sort of difficult to track because there are so many versions of the bill as it goes through its process. But what parts of the healthcare industry are really poised to, well, let's start with benefit the most potentially from the bill?
It's a great question. One of the things in the bill will be a tax cut for pharmaceutical companies, health insurers, medical device makers, also tanning salons. But those folks will benefit from the tax cut. The big question is what it'll mean for paying customers. Will they see customer volume drop? Fewer people buying drugs, buying health insurance.
Right. And so on the flip side, it seems as though most of the downside would be for hospitals potentially, companies with Medicaid exposure. Is that pretty consistent with what you're seeing?
That's right. So hospitals certainly stand to lose a lot. They could see, you're a hospital, you have an emergency room, you have to treat anybody who shows up there who's in medical distress, who's sick. Whether or not they have health insurance. And if they don't have health insurance, you might not get paid. You probably won't get paid. And that's what hospitals are really worried about. As you mentioned, also health insurance companies, particularly those in Medicaid, could lose quite a bit of money under this bill.
Now, I'm curious, you mentioned the tax cut will aid some of the pharmaceutical companies. At the same time, we have heard pretty consistent rhetoric from the president about bringing drug pricing down somehow. But is there any evidence of that in the actual bill?
There's nothing in the bill right now that tackles drug pricing, but the president keeps saying we're going to bring drug pricing down. He keeps making this promise, and so the question is, when will that show up? When is he going to do something that really will bring drug pricing down, or sort of show an intent to do that? Beyond sort of the campaign speeches and rhetoric.
Have we seen already, just very quickly, a lot of stock reaction as this process has been going on?
We've certainly seen hospital stocks come down, and also some of the health insurers have really sold off as well.